Chapter 9, Pre-Analytical Considerations. Please take a moment to review the objectives of this chapter. Again, remembering that you can pause at any time to review slides if you need to. Okay, so an overview. What is the pre-analytical phase of testing? It begins when the test is ordered and ends when the testing begins. There are listed some skills you'll need as a phlebotomist during this phase. Again, this is an overview of some topics that we're going to shoot through here in Chapter 9. Reference ranges and intervals. Tests confirm health or screen, diagnose, and monitor disease. Test results are compared with specimens of healthy people and consist of range of values with high and low limits. So a reference range is a range expected for any particular test. Basal state. The definition is a resting state of body early in the morning after fasting for 12 hours. This is usually when most drawing is taking place. The basal state specimen effects of diet, exercise, and etc. on test are minimized due to the fact that it's first thing in the morning and you've been fasting. It can be influenced by age, gender, and conditions of body. Here's some physiological variables that can affect and what effects they have on which tests. And there's a picture of jaundice. Alright, so some problem sites to stay away from are burns, scars, and tattoos. Try to avoid damaged veins, those that are sclerosed or hardened, and those that are thrombosed or clotted. Edema, it's swelling caused by abnormal accumulation of fluid in tissues. The veins will be harder to locate, and the tissue is fragile. Not to mention that the tissue fluid can contaminate the blood you collect. A hematoma, a swelling or mass of blood. They can be painful, can contaminate, and will obstruct blood flow. This is a picture of a hematoma. More problem sites, mastectomy, the surgical removal of breast. Obesity can cause problems. Veins will be deeper and hard to find. Alright, so this is talking about vascular access devices and sites. Please make sure you review these. An arterial line, a catheter placed in an artery. You should not place a tourniquet or attempt a venipuncture on an arm with an arterial line. Arteriovenous shunt or fistula. It's created to provide access for dialysis. It's the surgical fusion of an artery and a vein, usually located on the back of arm above the wrist. And there's an image of that. Vascular access devices and sites continued. Again, review these. This is a blood sampling device. Most of these things you won't ever have to deal with. The nurses will be dealing with special situations like this, but you should be aware of them anyways. A heparin or saline lock. IVs, now you might have to deal with these more often. And if necessary, it is preferred that you try to avoid an IV, but if necessary, you need to collect below the IV. The rest of these, just make sure you guys take some time to review. Again, like I said, they won't probably come into your life too often as an employee, and if they do, you will certainly be reminded of things to do and not to do in each specific situation. ports, again, for the most part, nurses will be drawing from these. Catheters, again, mostly nurses. Alright, patient complications and conditions. Allergies to equipment and supplies. For example, like I mentioned about latex gloves earlier, they can also have adhesive allergies for, like, if you use tape or band-aids, stuff like that. Sometimes there's an allergy to antiseptics, and of course I mentioned the latex allergy. Excessive bleeding. Patients on aspirin or anticoagulant may bleed longer. If the bleeding continues for more than 5 minutes, you should notify the personnel. Fainting can occur. If you know a patient has a history of fainting, have them lie down during a venipuncture. Nausea and vomiting will happen. If it happens, you need to discontinue the blood draw and apply a cold, damp washcloth to the forehead. Pain, there's some element of pain that cannot be avoided, but you should warn the patient before your needle insertion. Avoid excessive deep blind or lateral redirection of needle. No digging. If you hit a nerve, it will cause extreme pain, and you need to remove the needle immediately. Okay, petechia. These are tiny, non-raised red spots. Can appear on the arm when the tourniquet is applied. See if you have a patient have a seizure or convulsion, obviously discontinue the draw. Do not put anything into the patient's mouth, and protect patient from self-injury. Sometimes a hematoma will form. You need to discontinue the draw and hold pressure over the site. An iatrogenic anemia. This is anemia brought by blood loss from blood draws. Collect only minimum required specimen volumes. In other words, don't bleed the patient to anemia. Inadvertent arterial puncture sometimes can happen, although arteries are generally deeper than veins. Signs of this are rapidly forming hematoma and blood filling your tube very quickly. Infection. To avoid infection, make sure you practice the following steps. Like I mentioned before, nerve injury can happen. Usually if you choose an improper site, or if you go too deeply or quickly, if you dig too much, which is the excessive lateral redirection, or if you blind probing, which surely none of you would do. If initial vein entry is unsuccessful, you can use slight forward or backward redirection of needle to see if you just haven't reached the vein or if you went all the way through it. But again, try to make sure you avoid lateral redirection. Reflux of anticoagulant. If blood flows back into vein from collection tube, keep arm in downward position and tube below venipuncture site. Vein damage can occur. You want to avoid numerous venipunctures in the same area over time. Okay, so now we're going to talk about specimen quality concerns. Hemoconcentration is a decrease in fluid content of blood caused by stagnation of normal venous flow due to tourniquet, so don't leave your tourniquet on too long. Hemolysis, which is the one you'll probably experience most often, is damage to or destruction of red blood cells. It's when hemoglobin escapes into fluid part of specimen. So this can be pretty serious. It can cause elevated test values that are actually not elevated. Partially filled tubes, a short draw. Need to make sure if it's required, especially in like your coag tubes, that you get the proper amount of draw. blood drawn. Okay, you can have various ways to contaminate a specimen. Make sure you review those. And always make sure that your collection tubes, that you're using the correct collection tube for the test and that the tube is not expired. Alright, troubleshooting a failed venipuncture. Tube position, check those things. Needle position, again, I could read all these to you. You should probably review them, but you'll get better at this when you actually are practicing it. These are some slides illustrating. So go ahead and review these ways to identify improper needle position. Again, remember, you can stop this at any time and then start again. Alright, and then finally, there can be occurrences of collapsed veins when vein walls draw together temporarily, shutting off blood flow, caused by the vacuum of the tube within your tube, or plunger pressure is too strong for the vein, if the tourniquet is too tight or too close to the site, or if the tourniquet is removed during the draw. Sometimes you can have problems because a tube's vacuum will be lost because the bevel is partially out of the skin, or loss of vacuum due to damage of tube. So just be sure that you have good tubes and all the other things we've talked about in this chapter.